What are biosimilars? How are they different from generic drugs? A biological medical product is produced through biotechnology in extracted from or semi-synthesized from a living system such as microorganism, plant cell or animal cell. Biosimilars are similar biological drugs, clinically equivalent in terms of safety and efficacy to biological medicines. When the patent surrounding an original biologic formulas is no longer protected, other companies can release cheaper biosimilars with no clinically meaningful differences. Biosimilars versus generics. Nature of drugs. The nature of generics are similar molecular drugs which are small and fairly simple in their surface. They are synthesized from chemicals in a consistent process so that manufacturers can be sure that each pill has the same effect every time. Second one is nature of the biosimilars. Biosimilars are biological drugs which are made up by a living cell, typically an engineered bacterium or yeast. There are 200 to 1000 times the size of the small molecule generic drugs and far more structurally complex. Manufacturing and testing. Because generics are simple in structure and stable, they are easier to manufacture and consistent. Manufacturing and testing of biosimilars are complex, bigger and heavier, and often less stable. They require specific conditions like refrigeration. Biosimilar manufacturers need to follow a large set of tests and studies before release. Third one is functioning. Biosimilars are similar, generics are identical. Biosimilars are only similar and must be equal to its biological counterpart in terms of safety and efficacy. However, minor differences between the reference product and the proposed biosimilar product and clinically inactive components are acceptable. Biosimilars need not work in the same way as the corresponding biological. The only requirement being biosimilars should have the same effect as corresponding biologic. On the other hand, generics are exactly identical versions of their branded drugs and most have the same active ingredient as their branded counterpart. Not only identical in composition, generics also work exactly the same way as their branded counterpart. Both biosimilars and generic drugs are highly important for affordable healthcare, and in recognition of this, Indian patent laws provide stringent protections against the practice of evergreening by original drug manufacturers.